On the Health Watch, a new study is raising concerns about men and cancer in the decades ahead.
The study estimates by 2050, cancer cases in men worldwide will increase by 84%. Cancer-related deaths will spike by 93%.
Joining us now to discuss this is Dr. Mark Loafman, Chair of Family Medicine at Cook County Health. Dr. Loafman, thank you for being here. The numbers we just heard are pretty alarming. What is behind this trend?
Well, thanks for having me, and I really appreciate your addressing this topic. It's scary when you see the numbers, and I understand the concern that's there. A couple of important factors. First of all, men do experience cancer more likely than women, so they have higher rates to begin with. And then as we age, the likelihood of developing a cancer increases as well. So as men age throughout the country and throughout the world, we're seeing more rates of cancer, and they're basically projecting over the next 30 years, those rates will continue to rise. And the last really important part of this is that the cancers that affect men are not as easily diagnosed and early. There's no staging and screening for them. So we don't have as many preventive programs that are there to be able to help detect and stop those cancers before they happen.
Interesting. Doctor, is that part of the reason why this study chose to focus solely on men?
Yes, so what we've known is men are more likely to have cancer and more likely to die from that cancer than women. So that's already a fact that's out there. And the idea of the study is to look at what's happening in those trends. Really, it's a very much a call to action with the hope that now that we know this, we can take preventive measures to begin to address it. So it's not a foregone conclusion that this will happen. What it's saying is if we don't change our course, this is likely to be the outcome in the future.
So, doctor, can you take us through the most common cancers that men will face?
Yeah, lung cancer is still number one, and the factors that contribute to that are smoking, of course, and then occupational exposures. And it's really important. This increase is predominantly among low-income countries and racial and ethnic minorities, and those trends we see in the United States as well. So it's the occupational experience combined with smoking and alcohol use, all much more common in men, that really do trigger that cancer. Prostate cancer is also on the list, a uniquely male cancer, of course, and one that we don't have good universal screening for. And lastly, access to treatment. Getting treatment in the low-income countries and among low-income populations, they just don't have access to standard treatment that would treat and effectively cure many of those cancers.
You mentioned some of those habits that I know you're going to say are ways that men can reduce their cancer risk by staying on top of these threats that could make their odds worse.
Yes, we really stress that, and it's not to shame anybody, but tobacco remains the number one leading cause of both cancer and heart disease in the U.S. that's preventable. So we want to help all patients, all adults, and young people not start smoking, and then if they smoke, to quit. But also occupational exposure and early screening, so men don't access health care as well, and those preventive measures, we don't see the men coming in for preventive health care. Even if we find an early cancer, it's often this day and age treatable and easy to actually be cured. And so take some action, get into primary care, see your family doctor, do some good health screening and take some preventive maintenance. Again, this is not a foregone conclusion, it's a call to action. Change our course. We do have an opportunity to make a brighter future than this study predicts.
We thank you for that call to action for the men in our lives. Dr. Loafman, thank you for your time and advice.
Yeah, excellent information.